and welcome to another exciting edition of Mama's Nest. New moms, experienced moms, and all moms to be. This is the show that teaches you everything you need to know about parenting, motherhood, and childcare. This show is made specially for you. My name is Fome Ejumudo, your host for Mama's Nest. Mama's Nest is proudly powered by Cousins Baby, makers of child skincare products to support moms on their motherhood journey. Mom, you can do this. Welcome back. Today's episode is focused on a highly sensitive and often misunderstood topic, that of infertility and trying to conceive. It's an issue that many couples struggle with, and often you find that the pressure is on the woman. So once a couple gets married, the next step that the society or family expects is that they start to have children almost immediately. And when they don't meet up to that expectation, it's usually a problem. Joining me to discuss this sensitive topic today is Dr. Gladys Ohiomoba. She's a senior reg at FMC Ebute Metta. Thank you, Dr. Gladys, for joining us on the show.
I'm happy to be here.
Thank you so much for being with us. We also have a mom of one. She's Rahimat Yusuf Pedro. She is a brand communication specialist. Thank you so much for coming on the show to share your experiences. I know it's a very sensitive topic to talk about, but I'm glad to have you here today. Thank you for joining us on Mama's Nest. So I mentioned earlier that when a couple fails at this expectation, it takes two to get pregnant. It really does take two. One person bears the load of the pregnancy for 9 months, but then it takes two to do this. But the pressure usually is more on the woman. She takes most of the blame. She takes most of the blame. Why is that?
Well, in our society, this part of the world, and culturally in this part of the world, infertility, which is also referred to as trying to conceive in a layman's term, is still a social stigma to families and to women in the communities. If after getting married, they are unable to have children, because in this part of the world, like I said, a lot of premium is placed on childbirth.
Of course.
So once they are married, we want to see kids around the house. That's what everybody thinks marriage is for, procreation, right? So that's why when they are married and there are no kids around, people begin to raise an eyebrow, people begin to murmur under their mouth and say, where are the kids in the family? So when this doesn't happen, still culturally, they look at the woman like the fault is hers, really, until science has helped us evolve over time to show that, okay, it takes two to tango. And then if you look at the proportion of responsibility accorded to the couple, is 30% for the men, 30 for the women, and 30 for both of them. Because if you begin to examine the factors that is responsible for why is a woman not having a child, you begin to see that it's not just in the woman.
It's not just in the woman.
It's not just in her. You have the male factor.
Always her fault.
No, it's not always her fault.
Not always her fault.
No, it's not.
Well, generally, the society feels that, okay, apart from scientifically also, and of course, the woman has to carry the baby.
Yes.
All the man does is the sperm, and then
just
the entire time of everything is baby. So they see it as when the woman doesn't get pregnant, probably she's not womanly enough, probably her womb has an issue or there's an issue. That's why the child is not sticking and it's not sticking there. And then the fact that women has, like, would I say, a timeline?
Oh.
Yes, like there's a timeline.
After a certain age,
after a certain age, you lose your fertility, and you can still see a man of 70 years old still impregnating, 80. So far, their sperm count is still high and everything. So the pressure is usually more on the woman because you have like a limited time. You have a deadline. Like
deadline.
Yes, you have a deadline. For a woman, it's scientifically like you have a deadline.
Yeah.
It is unavoidable. It's something you can avoid. So you have a deadline. So the pressure is mostly on the woman. Because even if you say, okay, let's wait for the miracle to happen.
Yeah.
Time is going, and the older you get, chances of fertility drops. And you only have 12 times in a year to try, because you menstruate once a month.
Once in a month.
So once you miss this
We'll
month,
go into all of the signs.
so it's just 12 times in a year. And so like the pressure is usually more on the woman. For the man, even if the man is patient with you till you turn 50, and eventually there's no way for you, he can definitely turn around and start all over again with someone else. And
I get that. I get that.
So even if the society is not putting the pressure on, even you as a woman know, okay,
yes,
it's
true.
This has to happen now. And
but the pressure also is not good. We'll talk about that also later on in the show. The pressure doesn't help. But we also know that obviously ovulation is also very, very key to getting pregnant. So how do I know when I'm ovulating? I don't, the signs are, if you don't pay close attention, you won't even notice the signs. But what are some of the things that we can pay attention to see that, okay, yes, this is a sign of ovulation?
Okay, so medically speaking, you're supposed to ovulate. A woman is supposed to ovulate at least once a month, right? And at ovulation, most times, it literally means the release of an egg from the ovaries. So if you look at the physiology of a woman, and her reproductive organs, to say, you are not just always worried about ovulation, because really, when you look at the commonest factor that is responsible for inability to conceive, is not anovulation. Anovulation means a woman is not ovulating. It's more of tubal blockages. So if you take a sample of women, 10 women, why are they not getting pregnant? You see that in 6, 7 of them, their tubes are usually blocked.
Wow.
Okay. So, but people always, a layman would say, I'm not ovulating and all of that. So how would a woman know that she's ovulating? So little things that you can look at is a woman who has a regular menstrual cycle. She's menstruating every month regularly. It's most likely she's going to ovulate. That's one thing we look at. And then secondly, we look at a woman's change in temperature. So every day, if you monitor your body temperature, you see that there's a particular time when there's a 0.5 increase in centigrade, of your body temperature.
Slight increase.
And it happens very early in the morning. Yes, it usually happens in the morning. So you're just going to notice that slight increase in temperature. So that's a sign. But you see, some of these signs are a bit difficult to get because we're in an area that is endemic for malaria. We're in an area that is...
But I was going to ask you that
we don't have light, so you are sweating all night.
I could be hot.
you can be hot. There's no light and all of that. So those are little factors that do not make you recognize those little changes. But very importantly, most women know they monitor their cervical mucus. So you have this vaginal discharge every day, normal vaginal discharge. Just before ovulation, you see that it changes to something that is very sticky. They call it like egg white, the egg whites. You know, when you break egg,
when you break an
that
egg.
the way that is slimy.
The white of the
white part.
The raw one.
Yes, that raw one. So that helps you know that, okay, this is my ovulation period. Because that slimy helps with the movement of the sperms to meet the egg. Then lastly, science has evolved. We have what we call ovulation prediction kits. So it's just like your normal pregnancy kits, right? Those normal pregnancy kits. So you just check.
It's like a strip.
Yes, it's like a strip.
It worked for you?
You
were able to predict.
You know, then I think I was able to, but I don't know. But I was still in conception, because you being ovulating doesn't actually guarantee they're actually going to get pregnant. But because then, you know, we're trying to conceive, so it was basically everything.
You're trying everything.
You get everything, take this drug.
I think the most important thing in trying to conceive is identifying that factor that is responsible, because it's multifactorial.
And you would usually need to consult your physician.
Definitely.
That's really important.
Definitely.
Because okay, fine. Initially, when we started, of course, the expectation from
when
everyone.
Did you start getting worried?
Okay, first of all, I think we planned like, okay, we're going to wait like a year and just be me and my husband and exactly. But then the parents were already singing by 6 months into it, like what's going on, and then we're still putting them off that just to wait. Okay, we're waiting. But by the time we were like a year, and we two were like, wait, but even by accident, like this should have even happened accidentally. Because even the fact that we said we were going to wait a year, we're not taking any precautions like to stop it. So and we two were like, okay, like this is a year, like something should have even happened accidentally. Like,
That's when you started getting.
Okay, then we started getting worried, like, is there a problem? And then we decided to, like, okay, let's just go to the hospital. And then I can remember the GOPC we saw there was like, how is the marriage? You know, we're supposed to like say GOPC to give us a referral to see a gynae. And we said a year, and she was like, and you guys are here, and she's like, she's not going to write us a referral letter. You're not getting a letter. Okay, maybe you should come like after 6 months. I'll give you a referral. And then she just gave us a whole lot of lecture, anxiety, and the rest, and all that.
Any special styles to try?
Just like she was like, we should just take our minds off it. But then we knew that our minds were not on it too for like a year, and nothing happened. But she was like, just take your mind off it. Like, if nothing happened in 6 months, then I'm going to write you a referral letter. And then we just, funny enough, when we go back home, the parents already called it. So what did the doctor say?
Oh. I think I can remember, sorry to cut you, my own experience. Immediately I got married and I was flying back to Lagos, my husband, my mom said, don't let me hear you use contraceptive. I'm not even 1 hour old in the marriage. Somebody's telling me not to even use contraceptive.
I think they also do it just out of love and genuine care, but on the flip side,
I think it's just a cultural trait.
What would people say?
Yes, obviously it's cultural, but I'm saying that they do it out of just genuine love and care for you, not knowing that on the flip side, they're putting pressure on you. I think that's it. I think that's it, to be honest. But for me, the same thing happened. I got married in November, and in 6 months' time, my husband was like, "What hasn't happened yet? Is there something wrong with me? Maybe I should go and do a test." And I'm like, "Are you serious? Why don't you give yourself some time? Give us some time. Let's keep trying. It's not too late to start getting worried. We haven't been married for so long." So, and then when his mom heard, the mom said, "It can never be my child.
Really?
My child can never be unable to impregnate his wife. Like, with all the prayers and everything I've done for my kids, it can never be my child," that kind of thing. So I think they do it out of genuine love and concern. But then it also puts pressure on us, and pressure, I understand, is also not good, especially when a woman is in that phase of, I'm trying to conceive, worry, and it adds on stress, and all those things also have like a negative influence.
Yeah, basically, like, it takes the fun out of everything. Even the sex becomes scheduled. You're checking the calendar every time. Yeah, it becomes boring. Like, it becomes like a task. It's not something you do out of fun anymore, because it's like a goal to it. So it's stressful. Even that, and the whole anxiety and everything, I think even that contributes to it's not happening naturally.
I get that.
Okay, so I'd like to add, I think if we look back, WHO actually gave us a definition that if a couple has been married and they've been having unprotected sexual intercourse for at least 1 year, that is when you now say there's a problem. So that's why most times when newly married people come to us and they complain that they've not been able to get pregnant, we send them back and say go.
Them back.
But we also have some cuts. We also have some set of people that we don't send back. For example, if a woman is already in her 40s and she just got married, I won't send her back. I expect her to get pregnant immediately. Yes. So we use that age limit of 35 and above. We'll attend to her immediately. So, but if you are younger, because I see a 23-year-old girl come and say, "I've been married for 6 months," and I'll just look at her and I'm like, no. Just advise them, counsel them, most importantly, on their fertile period. Okay, and then.
So speaking of ovulation now, how long does it last?
Ovulation. Okay, so do you want me to take you through the process of fertilization?
No, just how long does that ovulation period last?
Ovulation, okay. Ovulation,
the window.
Ovulation, the window.
Yes.
Okay, so this window, ovulation basically means the egg has been released. Now that egg has a 24 to 36 hour span of survival. So if there are no active, it's very small. Yes. So if there are no active and well-formed sperms around the egg at that time, the egg is just going to die. So you can wait. You can see. You have 12 chances in a year. The chances of conception in a month is 25% only. Wow. So it's just 1 in 4 people that will get pregnant, even if they have sex.
1 in 4.
Yes. The window is very slim. Okay, so it's not just about the ovulation period.
It's not just about that.
So if this is your ovulation period, we always advise have intercourse 2-3 days before the ovulation period.
Because I also understand that sometimes the sperm doesn't give up that easily.
No, it doesn't. No. So sperm has a lifespan of about 3 days, 5 days, depending on where it's deposited, right? So in the vagina or in the uterus, it can stay for up to 5 days, depending on how
5
healthy.
days.
Yes, up to 5 days.
Wow.
So depending on how healthy the sperm is.
Okay.
So if ovulation actually occurs in that window, 22 to 3 days before ovulation and maybe a day, because you see, ovulation is more about your hormones within and also your environment. If you are stressed, maybe I just ran marathon from Mushin to somewhere, it's unlikely I'm going to ovulate.
I see.
Because you've caused some imbalances in your system.
In the system.
Yes. So that's basically.
I think that was where I was also going to with the idea that, you know, putting pressure on the couple and stress also has a role to play.
Okay, so putting pressure on the couple, I want to state that, you know, in this same part of the world, like what your mother-in-law said, you put more pressure on you, feeling that her son is exempted.
I know, right?
Yeah, feeling that. But it happens every time.
It happens every time.
And you know the funny part? When we see patients in the hospital and we find out that it's a male factor infertility, the women still try to cover their husbands because they don't want to go back and say, it's my husband.
There's something wrong with my husband.
They'll come and they'll be whispering. So it's, I don't know how to put it. It's just there. People always still want to believe that it's a woman's fault.
Even when the woman knows, they still want to let people know that it's the husband's fault.
It's a mindset that needs to change, really.
Yeah,
but we need to go on a quick break, ladies. When we come back, we'll go more into the topic. We'll go on a quick break now, and we'll see you shortly. Welcome back. It's still Mama's Nest, proudly powered by Cousins Baby, makers of child skincare products to support moms on their motherhood journey. I'm still here with my guests, Rahimat and Dr. Gladys. Dr. Gladys has shared so far some of her expert knowledge on trying to conceive and infertility, some of the ways that you can manage this very sensitive topic. If you're a couple trying to conceive, then this is certainly for you. We're diving deeper into the topic, and there's so much that we need to talk about. I don't think one episode really is enough to take everything that this topic entails. You mentioned earlier that you wanted to go into the stages of fertility.
Yes.
Can you please take us through it?
Okay, so I'll tell you how a baby is formed. What happens is you need a man and you need a woman, and the man has to have healthy sperms. Healthy sperms with about 39 million per ejaculate.
39 million to make one baby.
But yes, you need 39.
Isn't God great?
Yes. You see, even if a woman is going to do an IVF, you need even at least 100,000 sperms. We just need one baby, but we have to take 100,000. Wow. So I need 39 million healthy sperms at least, and I need a woman who is ovulating. So if you look at the woman's reproductive organs, I'll start from the vagina. Up, you have the cervix. The cervix is the mouth of the womb. And then you have the womb itself. And then you have the fallopian tubes. And then you have the ovaries. Yes, the one that looks like the Y. And then the ovaries. I'm sorry, I would have brought a model to demonstrate. Really, I should have. Then, if sexual intercourse occurs, sperms are deposited in the vagina. Healthy sperms will travel up the vagina into the uterus through the cervix. Okay. And then from the uterus, it goes into the tubes. Ovulation has occurred early in the morning, and then you have this egg is already inside the fallopian tube. Fertilization always occurs in the tube.
Inside the tube.
It has to occur in the tube. And then the fertilization occurs, then the egg travels, it's no more an egg, it's called an embryo.
Okay, after the fertilization.
Yes, it's now an embryo. Travels back into the womb and gets implanted there. That's what happens naturally. So if a woman is not trying to conceive, where would the problem be? One, it means that the sperms are probably not healthy.
Okay.
That's the first thing.
When you say not healthy, what exactly do you mean? Is it that it's not many? Is it that they can't swim? Is it that, what exactly is not healthy?
Okay, so if I take a seminal fluid for an analysis, what I will be looking at is the volume.
Volume.
Yes.
Okay.
I'll be looking at the morphology. You have some sperms that have head, they don't have tail. You have some that have tails, they don't have
really?
head. You have some that
so
have
not well formed.
so that's morphology.
What could be the cause of that?
Okay, so lifestyle,
I
basically.
see.
People who smoke, people who
I
drink,
see,
and
I
some
see.
other hormonal issues with the man, right?
And can be fixed, right?
Yes, that can be fixed. Okay. Then you have, if there's a problem with the cervix, which is the mouth of the womb, maybe there's a stenosis or there's an infection.
What's a stenosis?
It's a narrowing.
Oh, I see.
So the cervix becomes so narrow that sperms can't pass. Okay. That will cause infertility.
All right.
Now, or maybe there's infection, inflammation, like cervicitis, like that infection, basically. When there's infection, it makes that cervical mucus that we talked about earlier, it makes it harsh to the sperm. So when sperm gets there, it kills the sperm. It kills
the sperm.
Yes. And then there are very few people that have what we call anti-sperm antibodies. You know, all of us as humans, we have antibodies.
I've heard of that.
Yes. Antibodies are things that are the soldiers in your body that fight infections. So some people have soldiers that fight sperm. So once the sperm gets there, it just kills it. That kind of a patient can't get pregnant, right? So we pass through the cervix into the womb. Now in the womb, there are a wide range of abnormalities that might occur. Yes, that might occur, from fibroids to polyps to what we call adhesions. Maybe the womb is supposed to be a cavity, but because of infections and all that, it's clamped together.
Oh, I see.
You understand? So a whole lot of drama occurring there. Then we get to the tubes. Now, I said the commonest cause of infertility is tubal blockage. And blocked tubes is seen mostly following infections, any sexually transmitted infections, or basically any genital tract infections. And then if the tubes are blocked, sperm can pass through. Then we now get to the ovaries. Now there are also a wide range of abnormalities that can occur in the ovaries, from ovarian cysts to endometriosis to the ovaries having what we call premature ovarian failure. Okay, premature ovarian failure. And
there are many factors. So many factors.
What you just said now, like, majority of the issue still comes back to the womb.
Exactly.
Well, because I can remember when I had to run, when we had to do fertility tests, there were lots of things that was listed for me. TVS, this. The list they wrote for my husband was just SFA.
It's not fair.
He just had to do just one test, and I had to do like a whole lot of invasive.
So all those are the tests,
and all that.
All those are the tests to carry out to know
to assess each of those points, checkpoints, really. Yes. So those tests are basically I'll get back to those tests, and I'm going to get back to you saying that the man just has to do one.
Yeah,
do you know what it takes a man to even do that one? How many of them come? You have 10 men who have infertility problems. They don't come.
They don't even come.
They don't show up, and they just have one test to run. Because they know they will have to masturbate into a cup in the hospital and all of that.
I see.
How many of them even come up for that? You have to beg, coerce, and make them do
probably
it, and
counsel them
over and over again. And then to have a proper analysis, that SFA should be done at least twice, 6 weeks apart, to have a definitive result. Yes, result. So if the man comes the first time, there's no guarantee he's coming back the second time, because I'm sure he didn't enjoy the first one. So that's so I know it looks like what the man has to do looks small, but no, that SFA goes a very long way, because they have to be on drugs for longer periods. It's not like a woman. No, it actually goes. And there are some other tests that the man too can do. They have testicular scans.
Okay.
They do hormonal profile too for men. Yes. So there are some other tests that men can also do to determine why they are not getting pregnant. But we always investigate women first, usually. But these days, when a couple comes that they want to get pregnant, we do it together. We do it together.
We do it together. I think that should be better. Like, since you said they have to do all those tests, so why can't you just do it all at once?
Yes. But are you comfortable with sharing your story? What did it boil down to? If you're comfortable with that.
Well, yeah, it was actually fine. Okay, at least I have a baby now.
Yeah, you have a baby now.
So it ended well, but it was like a 3 long.
How long did it take? Yeah, 3 years. How long did it take from when you started running tests until
Okay.
when they
2
actually
years,
found out
actually.
what was
2
wrong?
years, actually.
Okay.
No, actually, nothing was wrong eventually.
Oh, nothing was wrong, thank God.
Yes.
So I'm going to tell you what that is.
Nothing was
It's
wrong.
called unexplained infertility. When you run tests for both the man and the woman, and you don't find anything
You didn't
wrong.
find anything wrong.
And so from when you found out there was nothing wrong until when you conceived, how long did it take?
Even after we found out there was nothing wrong, there was still the pressure.
There was still the pressure.
Yes, there was still, okay, of course, the parents were still calling.
But at least that brought you some relief that there's nothing wrong with me.
Because it brought us some relief,
Definitely.
actually. And when we told them, okay, there was nothing wrong, we are fine, they were still asking, hey, but they should have prescribed drugs for you. They should have, you understand, like, they can't just give us drugs, like, they're
There's
not
nothing
treating
wrong with
anything.
you.
But they're like, but at least maybe some fertility drugs.
So what did they advise that you do at this point?
At that point, they were telling us to go back to the hospital.
No,
and
what did the
probably
medical
go to-
professionals suggest?
Just relax and just try to, or then.
So
but
did
then
you pay more attention
we did
to
not
like?
relax. We still went to a fertility clinic. We still went to like a specialized fertility clinic where we considered IVF, considered IUI.
Wow.
We eventually had to go for an IUI.
Okay.
Because we just couldn't wait. Like,
you couldn't wait.
But funny enough, like just the first trial and it worked.
It worked.
So we chose that there was nothing wrong. Because even though the test I did too, we still had to run everything over there and there was still no issue. Then of course they wanted their money, so they're still gonna tell you want to do it. Of course,
if you want
do
to do it,
and
go
then,
ahead. And if you can afford it, I understand they're quite expensive.
Yeah, they're
yes,
they're quite expensive.
Even though
They're
IUI
quite
is
painful.
way cheaper than IVF.
They're also quite
but
painful.
still.
Wow.
That's quite painful.
For me, when my husband started getting, worried, then I started paying attention to when I would ovulate, and then we would try at that time. I think at that time we even tried doing some funny poses. But does that really help? Does it contribute? They say the woman should lie a certain way, raise your leg up so that the sperm can swim very well and it can stay there. But do those things really work?
Sometimes patients put a lot of pressure on you, and they will tell you, doctor, what position. So if you tell them nothing, they wouldn't believe that you care about them and you want them to
so
get
you just tell them something.
Forced to tell them something. I tell you, girls who get raped upside down get pregnant.
They get pregnant.
So it's not about the position, but still we encourage, for those who are having some challenges with getting pregnant, we encourage them to lie down. Yes, the normal missionary position, as you would call it, lie down, and then after intercourse, the woman should still lay down flat for at least 30 minutes, just to aid. Gravity should aid the movement of the sperm down there in case some of the sperm cells are lazy or are tired. Okay, yes, basically just to encourage. So apart from that position, my dear, anyone, if you do it in the parlor, if you do it upside down, if you do it in the car, anywhere, in short, when I was still a medical student, I had this. I usually go to some private facilities when we're on break to just see what's happening. And then there was this young girl. Many years ago, she didn't know she was pregnant. She came into the hospital. She was complaining that her tummy is just getting big and big and big, dear. And we didn't know. And she had not seen her period for 6 months. I tell you, she didn't have intercourse. She had not had intercourse. What did she do? She went for a party and she just had genital rubbing. That was all. And the guy just said, let me just rub a bit.
Oh, dear.
And she got pregnant. And probably he had an ejaculation. And we checked. She was still a virgin, truly. But she was pregnant, 6 months gone. She couldn't believe it. She almost died. So, yes. Yes, because
surprising.
Even a virgin has an opening, right? Through which your menstruation comes out. So you can imagine. Science has shown that if you spill sperm on a woman's thigh, those sperm will just keep moving up.
They're relentless, right?
Yeah. Some of them are stubborn.
Very stubborn species.
Some are very stubborn.
But that's surprising. That's surprising. That's the first time I'm hearing this.
It's very funny that it's usually those that are not ready.
Not planning to.
Find it very easy.
It's always very
so it seems.
Yeah, like they find it very easy, but those are actually ready
and
it's an irony. It's actually an irony. Getting pregnant, rearing kids, it's an irony because
really
you have a lot of people who are ready, and then you have those ones that are not ready. I'll give you another example. Yesterday, in my consulting office, a lady just walked in. Her baby is about 15 months old, and she just walked in and she was looking all sad, and she came in with the baby 15 months. So the first thing that came to my mind is, of course, she's pregnant. But this baby is 15 months old and she wasn't ready. And I was like, Madam, can you just please smile? She was like, no, doctor,
Oh.
I'm not ready. I was like, you're not ready, so why didn't you use contraceptives? Anyway,
I
congratulations
didn't
in
plan for
advance.
it,
She was,
but
she
you
didn't
didn't use
plan. You understand?
contraceptive.
But you're, okay, I was like, you're married, and it's just a blessing. You have to.
Gap. I had a cousin, like, she just gave it like barely 3 months. She got pregnant again. Yes.
Yes, you can get pregnant.
Just
Oh,
3 months
dear.
after.
3 months,
Just
yes.
3 months after she had a child.
I'm sure. I'm
Even
pretty sure she's
herself
not happy
was-
about
She wasn't.
that.
She was trying to hide it for a while, but then
Yeah,
you can't hide
I
pregnancy for
totally
that long.
understand. I have a few friends
Because
too.
she just gave birth, and then again she was worried about work to like going back
It's
to
a
the
lot
office
of
and
work,
telling
'cause it's
them
like
I'm
you're
gonna have
raising two
maternity leave
babies
the following
eventually.
year, and
So
When
there's a
they
lot
give
of
birth,
pressure.
it's a lot of
There's a lot of
work
pressure.
with
There's a
that
lot of
one.
pressure.
We
There's
need
a
to
lot
go
of
another
pressure.
break on another break, ladies.
All right.
Thank you to our guests, Dr. Gladys and Rahimat, for this very intriguing discussion on trying to conceive. I'm sure you have lots of questions yourself. Please don't forget that you can send them in, send it in as a comment, or simply send a message to any one of our social media handles now scrolling on your screen. We need to take a quick break, and we will be back shortly. Also, don't forget to follow us and like so that you don't miss a thing. Mama's Nest is proudly powered by Cousins Baby, makers of child skincare products to support moms on their motherhood journey. It might seem difficult, but don't forget, Mom, you can do this. We'll see you in a bit.